When talking about RDS, respiratory distress syndrome, it is a hypoxic disease. They're going to have low oxygenation. These are babies who were born prematurely. They do not have enough surfactant, and if they do, it's not mature, and so their alveoli are closed and they need to be opened. So how do we open them? We give them surfactant and we give them PEEP or CPAP, and that generally is enough. You'll see some cases of high flow nasal cannula, which in essence is CPAP. So we're going to open up those alveoli and keep them open, and that's how they get oxygenation. If those things do not work, we're going to have to move towards ventilation, and you'll find that occasionally. And interestingly enough, whenever you have a baby who's not ventilating, who was born prematurely, doesn't have enough surfactant, you'll find that they're either going to oxygenate or ventilate. It's very rare that you'll find a baby who is ventilating and oxygenating as a preemie. Now, as they get older, they'll have compensated ventilation. In essence, they're going to look like a baby COPDer. With these little babies, like we talked about the last slide, if their ventilation starts to decrease, we're going to have to put them on a ventilator, and again, maintain their PEEP or CPAP to keep their lungs open, keep that FRC up. We can still give surfactant through the ET tube if they're on a ventilator, so that's not an issue. We're going to make sure their SATs stay up. We're going to make sure that PaO2 stays between 15 to 80 for these preemies. We don't want it to get too high or else they'll get O2 toxicity, ROP, remember talking about the blindness, that type of thing. We can also give Lasix. It works really, really well. You can nebulize Lasix to these kiddos when they get too much fluid on their lungs, so that helps them breathe much easier. You can see the effects of that almost immediately when you give that. Also, we're going to maintain nutrition. We can either give it to the stomach or through the veins, and these babies are going to have a really high metabolism. Not only are they small, but they're also sick, so they're going to be metabolizing much faster. Just keep that in mind when we give medications, pain medications that may metabolize faster, but at the same time, their kidneys and their liver are not mature, so we just have to kind of look and see how that kiddo does. And then also, of course, always keep these babies warm. Thermoregulation is very important. We've talked about quite a bit how cold kills. We must keep these babies warm. Okay, we've talked about maintaining FRC. We've talked about giving CPAP. We can give high flow nasal cannula. We may need to put them on a ventilator. We can do all these things, Lasix, pain medications to help the baby, and different things to increase lung compliance. But one thing we haven't talked about is something called kangarooing, and this is a word off kangaroos, obviously. And this they have found to have extreme benefits to the baby. We have been doing this for years. You'll find research out there to make it sound like it's this newest greatest thing, but we've been doing it for years. And here's your fun fact of the day. I remember when I was in school, I read some research somewhere, and it said that back in like the late 1800s, they had lots of orphanages, and this particular research was talking about one in Russia. They found that babies were dying in these orphanages, but they didn't know why. It wasn't some kind of epidemic going around. They weren't sick, they didn't have fevers, they had no signs or symptoms of being ill, but they were dying. It was like SIDS, but almost all of them were getting SIDS. What they found out is that these babies were not being held, and if they did not feel loved, they died, which sounds absolutely crazy, but true. So this is not a new thing. This is forever old. These babies, whenever they're really, really sick, if they can handle it, if they're not going to be overstimulated, if it's not going to make them code by moving them around, we can do this thing called kangarooing, and the mom holds them up against her skin. That's the important thing. So it's skin to skin. You might hear nurses say skin to skin. You might hear them say kangarooing, but it's the touch, and it's literally the mom's healing touch. It's pretty important.